Sure. I'm Maureen Bisognano, and I'm the President Emerita for the Institute for Healthcare Improvement in very warm Boston, Massachusetts, here in the U.S. Bob asked me to say a few words about my plenary in Gothenburg a few weeks ago, or Göteborg. I'm trying to learn how to say that correctly. But it was a wonderful forum, and it was there were so many new ideas and new perspectives, and I think that our work on kindness and healthcare really permeated. If I could say, I was sitting next to Kate Armate, the CEO of IHI, and we were looking at word clouds pop up, and kindness and what matters to you were bigger than any other word at different points during the forum. And so I wanted to say thank you to everybody for everything that we're all doing together. And I pulled out a little bit from my plenary. And as Dom said, I named it Eudaimonia. And the reason that I named it that is because I like to put a word or a concept in the beginning that makes people curious. And I haven't found a whole lot of people that have heard that word before. So I wanted to make people kind of lean in and say, well, what does that mean? And it's a word from Aristotle, which means human flourishing, happiness, focusing on doing good, and compassion. And so it felt like a word that resonated with me after our kindness work. It felt like a word that said we could start thinking about humanity and health and healthcare in a different way. And rather than look at it from a technical and scientific point only, that we could start to look at it from a humanity and a flourishing point of view. What does it take to help someone to flourish? And I think there is the science piece, which is critically important, but there's also this human piece. And so I named my plenary Eudaimonia to hopefully stimulate a little curiosity so that people would start to say, well, what does that mean? And who are you talking about? And what I'm talking about here is that we, I think, need to think about patients and communities in a different way through the lens of Eudaimonia. And then our teams, especially in this time of COVID, these past 2.5 years have been so debilitating to so many. And I think if we start to look at Eudaimonia at a team level, it may stimulate some new and innovative ideas for how we work together. And then thirdly, ourselves. Like I always say, you can't give what you don't have. And if we don't take care of ourselves, there's no way that we can actually practice human flourishing for others. So when COVID hit maybe about 2 years ago now, I'm normally out harvesting in the field, out visiting people and talking to people, but we were so restricted. So I began a process of reaching out to people around the world and interviewing them about what does flourishing mean to you? What does health mean to you? And I interviewed many, many, many people, but I'll tell you one quick story. This is Jackie. She's 24 years old, a legal assistant, and she's attending Harvard to get a degree in mental illness and mental health and flourishing herself. So I talked to Jackie. I've talked to her many times now, but about what does flourishing mean to her? What is really living fully mean to her? And she was describing that in her youth, she had some very, very stressful things happen in her life that caused her anxiety and stress and depression. And she sort of kept them under wraps. She never really talked about it because the culture was such that, it didn't invite that kind of sharing. Then early in the COVID pandemic, she became so distressed and so concerned about her mental health. She called her primary care doctor, and the doctor said, you really need to see somebody, a psychiatrist or a psychologist, and gave her a number to call. Jackie told me that she called the number, and the person who answered the phone told her in 6 to 8 months, they thought they could see her. And she became that interaction caused her stress levels to get even more difficult for her to live with on a daily basis. So she called a a friend of hers who had also gone through some really difficult times. The friend gave her a telephone number of a different organization, not a traditional psychiatrist office, but an organization where they look at what I would call flourishing. Jackie called that number and they said, we'll have somebody call you back in a few minutes. A therapist called her back, and the therapist said to her, how do you want to interact? And Jackie said, I'd like to text you because I need to stop and think about what I'm going to say. So the therapist said, okay, text me. And immediately they began communicating. The first day they went back and forth almost all day. The second day, Jackie texted the therapist a few times, and then it was every day for several months. And then it was every week. And then Jackie told me that after a year and a half now, Jackie feels completely in control and very well supported. Her therapist called her. She's never met her therapist in person. Her therapist is 28 years old. Jackie can describe her. She has a huge regard for how she has treated her, not as a patient, not as a sick person, but the way that she constructed her care made a huge difference. So the therapist told Jackie a few weeks ago that she was going to need to go for surgery herself and she was going to be out for a while. And the therapist said, do you want me to introduce you to another therapist? And Jackie said, no, I'm fine. I'll wait till you come back. It was going from extreme stress to I'm fine. And the thing that I loved about the way that they constructed Jackie's therapy was that it wasn't just the way that she interacted, but anytime you feel stressed, you can go to a physical place if you like. And the physical place is a farm. And they teach you farming and they teach you different ways to interact with people, with the nature. And so it's a very different way of thinking. Jackie's one example, but as I said, I interviewed many, many people, and I began to develop a new way to think about healthcare. And I called it the 4 T's. The first one was tempo. The old way is you call 6 to 8 months, or you get some kind of an appointment. Then, another person I interviewed was a 60-year-old man, had been diabetic for his last 20 years. He said normally he would see his doctor twice a year. And the doctor would look at his blood sugar and results and say, okay, do this, do this. But when the tempo changes, when you interact with someone, maybe daily or weekly, or the man with the diabetes now has one of those bits of technology that it's inserted into his belly, and every 3 minutes he gets a measurement of how he's doing. That tempo of interactions, not once a year, but every few minutes, has taught him everything he needs to know about managing his health. He knows if he eats this, he's going to get into trouble. He knows if he doesn't walk, he's going to get into trouble. That tempo has allowed him to control. So I started to think about tempo, and I'm doing a lot of work now in looking at new models of care where we look at interacting in a very different way, from an annual visit to how do we increase the tempo. The second was touch. And by touch, I meant in the old way, people told me that they had to make an appointment and go and see their physician or their practitioner in person. But what I found in interviewing people all over the world is that they find incredible help using technology, virtual visits. It doesn't have to be in person. There are so many different ways now that we can interact with patients that works on tempo, but also is a different way to think about that interaction. The third thing that came from all of this was teamwork. Every person I spoke to said they don't have a team. They go to this specialist or they go to this person, they go through the whole story, they get some advice, and then they go to the next person. And again, they find that they have to start all over again. Sometimes the professionals contradict each other, and sometimes they support each other, but it's unpredictable to understand what's going to happen. They told me teamwork matters. And some of them felt like they were now the captain of their own team and they felt like they were in control, but it wasn't deliberate. It was something that they had to pull together. So I began to think about different ways that we might construct healthcare that automatically assumes we come together as a team, we share information, we respect each other, and we circle around what matters most to the person. And then finally, trust. And I didn't have that word on my 4 T's in the beginning, but every single person I spoke with brought that word up, and they said, we need to understand that we can trust our system. It turned out that tempo, touches, and teamwork were causing some of the gaps in trust. So I began to think about these 4 T's as ways that we might reconstruct healthcare. And I've started to look now across the world for new models and say, how well do they meet this? So Nicki here may be able to share with you some of the work that she's been doing in her home country and creating these maps. I'm seeing these maps now emerge from really innovative people around the world, but I'll share Nicki's, and Nicki, do feel free to join in and share any thoughts you have. But here's a patient in the middle, and looking at all of the issues that surrounding this man, looking at the social issues and the family issues and the housing issues and all of the things that contribute to good health, to flourishing, are on this map. But what I find is that mostly we take one point of view, we look at the patient through one lens, and we don't see the rest. And we can't see flourishing if we don't look at the whole person. So I love these maps. Nicki, do you want to add anything?
I just said these maps really did make a difference in the service that we were running. So for this guy, the general practice saw a very aggressive man who was rude to deal with, and he didn't turn up for his appointments on time. They didn't see the whole picture. So Tamati, he didn't drive. He lived about 500 meters from the surgery. He's living with end-stage COPD. He had to walk to his appointments. And when he's ringing for an appointment, it's because he's in an exacerbation stage. Maybe he needs more medication, he's run out. By the time he gets to the practice, he's out of breath. He's really, really wound up. And he's not in a space where he can make niceties with these staff. He needs to be seen. And so he had a red flag on his file that he wasn't allowed to be seen without multiple staff members present. But it was actually about the way that he was being treated and understood or not understood. And so once we could change some of that and let people in to see this helicopter view of Tamati, things changed for him. So we managed to reduce his ED presentations from 27 in the year before we started working with him to 4 in the year that he had some extra wraparound support in the form of one nurse who he could text or call when he needed help, or help to get to the surgery, or help to pick up medication. So this simple map was a way to help people see Tamati as a whole person, and it made a huge difference to his care. So it does work. It's super simple, but it really works.
Thanks, Nicki. And the other thing that Nicki has done there is she spoke about a nurse who helps. And I love this model that they've created there, transitional care nurse, where the patient and the family, the community are in the center. But this transitional care nursing model brings together all of the pieces. And Nicki, maybe you can put a link to an article or two into the chat, or we can share those. But there's so many wonderful things when we start to look at the role is not only I'm, to prescribe, or I'm to diagnose, or I'm to do, but really I'm to see. And I think that's a big part of our kindness routine here. So I think what we're seeing here is a new model emerging. The 4 T's have just, I would love to hear your reactions to them in the breakouts, and whether or not you think that there's any merit to this. But what we're doing there with the 4 T's is we're seeing the whole person. We're mapping the assets of the community, looking at the patient's family and our traditional or transitional care nursing model, or anything else that's out there. We're redesigning care, and we're asking patients, families, and communities what matters to you. And as you know, if you've joined the What Matters to You monthly calls, what we're seeing there is somewhere around 70 to 80% of the time, when people ask a person what matters to you, they find out something they didn't know about that person. So just that simple question is helping us to make the map and to see everything. So with staff, with our teams, I am also figuring out that we've got to think about these 4 T's. And my thoughts here are practicing micro affirmations and kindness. We're all the time talking about microaggressions, but we're not talking about micro affirmations. And those little tiny things that you can do or say make a huge difference in people's lives on a daily basis. What I'm seeing is that those little micro affirmations not only generate a sense of I'm being visible, I'm being seen, but that sense of connection and coordination is really, I think, wonderful. And it's a demonstration of our work on kindness in healthcare. Ask the staff what matters to you and act. As you're seeing from the What Matters to You movement, if you look at wmty.world, when we're asking staff what matters to them, oftentimes we're hearing surprising things. It's not big. Most of the time it's small, doable right away, but asking them what matters and then hearing and doing something is making a huge difference at a time when the stress levels I've never seen in my very long healthcare career at this kind of a high level. And then listen and solve together. And then for ourselves, Pedro and I were talking about, Pedro put in a picture of this car and said that this is one of the new electric vehicles, and it's wonderful. It's like one of the top of the line cars and does everything perfectly, except that if you don't plug it in, it won't go very far. So we've got to recharge the car and we've got to recharge ourselves. We've got to figure out, what does it take to be kind to yourself? What does it take for you to stop and think about the 4 T's in your own life and to really make sure that you take care of yourself? I have a little video. David Freiberg is on the line, I think, and David has been creating a sense of videos that talk about some of these things. And so I'll play you this 2-minute video, and then David, if you'd like to add on anything, that would be fantastic. Well, I'll tell you what, I will, we'll put a link in. And David, do you want to say a word about the work that you're doing with Envision Kindness?
Sure, and thank you, Maureen, for mentioning it. The simply put, a way, what we've been working on is a way to help naturally stimulate, if you will, the innate tendency to kindness. So I work from a space where people are born kind. I can't say everyone, because I don't know about always or never, but I'd actually make the statement that the vast majority of people are born kind. They just sort of, people often lose their way, right, when we have competing pressures and ego and the search for meaning and purpose and how do I matter and all of that put together.
David joins us quite a lot, and David, maybe you could put a link to your Envision Kindness in the website, so that in the chat, so that everybody can know that. But the work that you're doing is amazing because it makes visual and auditory stimulation about the importance of connection and kindness. And I just really love all the work that you're doing. So just to wrap up before we go into breakouts, I love this quote from Jane Goodall: only if we understand can we care, and only if we care will we help. And so I think it's about seeing first and understanding, and then once you care, then it will give you what you need to do to help. And I think that's what we're hoping to do here with our kindness in healthcare work. So just a quick overview of the 4 T's, 4 T's for patients and communities, 4 T's for our teams, 4 T's for yourself, and then envisioning kindness. And I guess I could say, David, everybody should go and hug somebody.
Super, super insightful. Lots of people nodding, many people thinking that it resonates, lots of smiles with the video as well. And I think there'll be lots of food for talk in the discussion. It was wonderful that you were able to bring in Nicki's insights too. Maybe, Nicki, shall I come to you first? Let's get some reflections from you as my co-host. What was going on in your chat? What was going down in the chat room?
Right. So I was in a room with Helen Rogers, and it's her first meeting this month. So welcome to Helen, and with Kirsty Shires, who's a GP, and she's been to a few of these. So we touched on the 40s. We talked about some of the difficulties of the current climate. And I guess the tension of knowing how we want to be, but not being able to be that way because of the external pressures and, COVID. Helen, she was sharing a really great sort of case study. Helen, I don't know if you'd like to sort of share that quickly with the group.
Yes, absolutely, I can do. So hello, everyone. I'm Helen Rogers, Assistant Chief Nurse for Patient Safety and Clinical Governance at Manchester Foundation Trust. And I had the privilege of being at the Gothenburg conference, which is how I've got the connection into the group. So I'm very delighted to be here because this is something as a nurse for 40 years that I'm very passionate about. Thank you. So I was just sharing a little story there that was quite powerful because it was a letter that came into the complaint inbox last week. And it was a story of really our EDs at the moment, our emergency departments. And it was written by a retired GP who had needed to accompany a neighbour's mother into the hospital because the ambulance wait was too long. It was 8 hours and she'd fallen and she'd banged her head. She was worried about being a head injury. But she wrote a really powerful testimony of how she felt that the experience of being in ED for 12 hours, which was how long sadly the 91-year-old had to wait until she was reviewed by a clinician, was actually her comments were, after being a GP in the health service for her career, it saddened her immensely because she felt we were not delivering care, but we were warehousing and processing our patients. And she said, due to the conditions that people were working in, she felt that they had become dehumanized to the conditions. And she said it was really sad to see. And she said, actually, when they did she couldn't fault the actual interventions when they were seen, and people were kind and compassionate, but that whole 12-hour wait was an absolute horrendous experience. People lying on the floor, not enough chairs. So she was acknowledging that people were working under pressure, but from a patient perspective and also a retired professional perspective, she was just reflecting back. And though for me, her words were really powerful, they stayed with me when she said we were warehousing and processing, but not actually caring and treating. Thank you.
Helen, thanks so much for sharing. And it's a really stark reminder, isn't it, that these things that we talk about, people aspire to, but in reality, how is it that the context that we find ourselves in makes these things really difficult to be able to do? And I think that's resonated with a lot of people, lots of nods and sadness about how that has landed. Maureen, tell us what your group talked about. Did they talk about the difficulties and challenges of being able to do this, or was there, I guess, more aspiration or any positive examples of where this is able to be the case and the norm? What was your group talking about? And you can nominate someone as well if you want to pass the button to.
A bit of both. We had two Monicas, and we had Julie and Mark and myself, and had fabulous conversation. We talked quite a bit about some examples of not walking by when you see an unkind circumstance. Monica was describing a circumstance where she saw someone, a clinician, be unkind to a younger clinician in front of a patient and a nurse, and that whole circumstance and how she dealt with it. We had quite a conversation about not only not walking by, but how do you interact with someone when you see them being unkind in a way that's not unkind yourself? And that kind of went back to the 4 T's, and we started brainstorming a bit about models and tools. And is there a way that we could, Julie was describing, build a model where you can understand what someone's going through as you begin to think about interacting. Julie, I don't know if you want to describe what build means a little bit more.
it's about describing the behaviour, understanding it, not possibly silently, just stating the impact with no kind of, not an emotional attachment to it, listening to the other person's point of view, and then kind of deciding going forwards on something, a change to the situation.
I would say our group was both interacting beautifully, the lessons from the 4 T's and some challenges, and also some lessons from kindness, and really put out there for us, is there, as we go forward together as a group, is there something we can build that might be helpful for students, for patients, and for caregivers?
Wonderful. And I think that piece about what can we do practically to help enable this more broadly is a really important point, recognizing the previous comments about the context in which we find ourselves around hurry, etc. Thank you for that feedback. We've got probably time to just hear from one further person who's got something burning to say around some wonderful insight that they gained, perhaps a new contact, a new pen pal that they're now thinking, my gosh, how did I not know this person existed in the world? I want to keep in touch with them. I think we all end up thinking that about people like Maureen and Nicki, but anyone else want to share anything about what they discussed? I'm just looking for hands up or people in the chat. Oh, we've got someone. Hester.
Hi, I want to say thank you to Sumi, Wayne, Sue, Chris and Simone who were with me, and I thought Sue came out with a really poignant thing, and that was that with the 4 T's, the teamwork doesn't feel as inclusive for patients and families. It feels like a staffy thing, not a inclusive thing. And she mentioned the word together, which I thought
I love it.
Sounded much more inclusive. And we also had a discussion about inclusion in the wider sense of inequalities, etc. And again, I thought that kind of together really kind of nailed that a little bit. We had lots of other discussions, but I just wanted to share the T for together.
Wonderful, thank you. And I'm not surprised that Sue has given us a bit of an upgrade here, and this is exactly what Maureen's looking for: additional T's or supplementary T's or new T's. So that's super fantastic. Listen, we're nearly out of time. I guess it's just for Nicki, Maureen and I to say a big thank you for you all joining. We could go on for much longer to have these discussions. They always feel so short as ever, but we know that you've all got lots of other things to be doing. I think if you'd like to keep in touch, particularly on the T's, I know Maureen is really welcoming of continuing that discussion, and lots of other things have spun off, which I'm sure we will pick up around some of the resources and education. I also just want to do a shout out for James Mountford, who sadly can't be here because he's actually having a leaving do from his current workplace, and he's heading off to France for a few months to go and be doing some super amazing work, helping with a gang of people, working with families and others to support people from Ukraine who have been rehomed over in France. So James will be, I'm sure, calling in from a glamorous location of a French farmhouse, like many others on vacation and other trips. But James is the first one he's missed, and I know he's super sad. Nicki, you are the custodian of being the co-host with me. What have we forgotten? Any other announcements and goodbyes and thank yous?
No, just thank you all very much for coming, and a special thank you to you, Maureen, for shedding some more light on the 4 T's. I think really important with the 4 T's is that you have included ourselves in it, so it's not just shining a light on patients, but also within our own teams. How can we employ the 4 T's and with ourselves in terms of self-kindness, which is often the biggest challenge for us in healthcare? How can we employ the 4 T's to make our life better and to help us to flourish as both individuals, but also our teams, which has big flow-on effects to our patients, as we know. So I like how holistic you are with the 4 T's.
Send examples. I put my email in there. Nicki, I love that. I think if we think about our own examples, that might be helpful for us to even then spread out to others.
Yeah.
Wonderful. Well, on that note, please do keep in touch with Maureen on the 4 T's. If anyone's got suggestions or wants to volunteer for a future session, please do let us know, and stay well and stay safe. And thanks so much for joining and staying till the end. It's been really wonderful, as always, to feel the warmth and connection with you all. The challenge and support is wonderfully high, and super to see you all.
Thank you all.
Thank you.
Thank
Thank you.
you.
Bye.
Bye.